just wanted to say thank you so much for agreeing to do this. I was, really shooting in the dark over here in terms of who could I get for the third talk. And I was really excited about this topic. I put it out to the people in Kuthuta yoga to say which, vote on the topics that you want next. And there was about five topics, your hormones and yoga. There was aging and slowing down aging, and there was also weight control. And this topic was ahead, leaps and bounds from the rest. And I am totally intrigued by hormones as well. I recently read a book. I forget the Hormone Cure by Dr. Sarah Gottfried. I know there's so many books outside there, and it was so interesting to see the relationship between the hormones and the role that stress plays in this whole equation. And in the last two sessions, we spoke about stress in relation to fertility and how obviously yoga helps with stress. And the previous one before that, we spoke about the immune system. So I'm so happy to have you here. And I know you are no regular doctor. And I want you to explain in your own words what exactly a naturopathic doctor is and how does this differ from a naturopath or just your regular GP or medical doctor?
Yeah, sure, Towani. Well, naturopathic physicians are trained in Western medical sciences. So we learn all the same study of tissue types, pathology, Western medical diagnosis and terminology. We do imaging and we order lab tests and we diagnose people. It's all based on Western science. It's not Eastern, although we do get a little bit, got a little bit of tongue and pulse diagnosis. So I check all my patients' tongues, even via video. And I also, there's 6 pulses that we can check. So I have a little bit of Chinese medicine training, but most of it's all Western. And the difference between a naturopathic physician and a lay naturopath, we call them, which you can get in a mail order degree, is that I went through 5 years of postgraduate medical training. So that was after my undergraduate degree. And then me personally, I have a master's degree in counseling psychology. I also got in the early 90s. And then in the early 2000s, I went back for my naturopathic medical degree. So naturopathic physicians have to go through that type of postgraduate training. And then after we learn all the basic medical sciences, we learn how to help heal people. And that's where the training difference is, because we learn more about vitality and stimulating health and how all the body systems work together and how to restore physiology. We also learn how to diagnose, how to prescribe pharmaceutical medications. In Oregon, I can prescribe 98% of the pharmaceutical medications a medical doctor can. Each state has its own regulations. I had to go through 2 sets of board exams. So we're highly trained medical professionals like DOs and MDs, and we provide a lot of primary care in the states where we're licensed, which is, I think, about 21 states now. That's totally different than someone who, took some classes on a mail order thing and is a health coach or calls themselves a naturopath, which is illegal in states where we have licensure. But in the states where there is no regulation, people are calling themselves all kinds of things. So the public should be aware of these kind of distinctions and how to find a good provider.
Yeah, what I really like about what you said was the focus on wellness and vitality, as opposed to really looking at the disease, but you're looking at because health is all encompassing. I want us to jump right into the topic. I know you look at a whole lot of things, but I would like to, narrow down your expertise and your knowledge to this field of hormones. And I know everyone is controlled by hormones and hormones are regulating the body functions, but I think as women with our, menstrual cycle, we tend to be a lot more aware of our hormones and our hormone cycle. And I've seen a lot of hormonal issues as a yoga teacher over the years. A lot of my clients come with painful periods, missing periods, PMS, which tends to get better, as they do yoga. There's also a lot of weight issues after having children. And even when people are dieting and, exercising, they're still struggling to get off the weight, sometimes problems getting pregnant. And I think a lot of people don't realize that diabetes is a big hormonal issue. We kind of just separate it, but diabetes is actually a hormonal equation as well. So am I imagining things? Is there an increase in hormonal issues at this moment? What are you seeing in your doctor's office?
Well, it depends. I saw that question on your list and I thought it was interesting. And what I thought was, does Towani mean in this last year, because so many things are different, or does Towani mean in the last 50 years? We can take a historical perspective on anything health and choose a time frame. I think I've been working in medicine for about 15 years now, and I've been in healthcare in general since 1992. And there have been a lot of changes. And before that, there were changes. There were changes for us as women with history and with things like the birth control pill being developed, right? Yeah. Which when it was developed was such a boon for women because abortion was hard to get and we didn't have a lot of options. So with those kind of advances come effects that we see, we're still seeing 50, 70 years later. So I think that women in this country are incredibly tolerant of hormonal problems. It's like sleep problems. And we're like, well, everyone I know has these problems, so they must be normal. They're not normal, they're common. So American women, as long as I've been practicing, and I think even before that, women who, I grew up in the 80s and they were feeding us birth control pills like candy when we were teenagers. And I work with a lot of women who are my age, and I've always worked with women basically over 45 and mostly over 50 since I started practicing. And it's interesting that I am in the over 50 category now, because now I get to experience some of these things, right? But I also get to see some of the changes in what's happened, where now I'm treating women in their 30s. They weren't necessarily given birth control pills or weren't on them as long as people maybe in our generation. So I do see that there is a blip happening right now of the women who are between about 38 or 40 and 55 or 60. And all these women were on birth control pills for sometimes 5, 10, 15, 20 years. And that has affected our hormones as a cohort. There's also an increase in toxicity. We don't have very good regulations in this country. In Europe, they follow the precautionary principle, meaning something has to be proven safe before it can be manufactured and delivered to the public. Here, we have to prove it's unsafe before it's taken off the market. Wow. So, totally different standard. And then just the increase in stress and how we have chosen to live our human lives has changed, and we've just gotten more and more fast-paced with all these advances, technology and all these extra things we can do every day. So I do think, it's funny. I love that your people, your customers, your cohort, your followers were so interested in yoga. Yes, your students really, in hormones, because women we know at a basic level, hormones have to do with fertility, weight loss, mood, everything. They, like you said, and we get this little window every single month into our hormones, healthy or not. That's why I love treating women. I'm like, man, I don't know what's going on with them. They're a mystery. No, I mean, I'm kidding. I do treat them, but women, we're easy because every single month we get this little window into basically, are we in good health or not? And the hormones always tell this story. Hormones are just messengers in our body that tell our body what to do, and they're not limited to female hormones. I have a little, I don't have slides because I'm not really good with those kind of graphics, but I have a little thing here that I made.
Okay.
So I hope it's showing up. I think it's showing up the right way on your screen. But there's a triangle, and in our bodies, there's a triangle between thyroid hormones, adrenal hormones, which I'll explain in a minute, and then female hormones, and they all work off of each other. You cannot separate them.
Wow.
And I would actually put vitamin D is actually a hormone in structure. It's called a vitamin, but when you look at it, it looks more like a steroid hormone, and it is also multifunctional in our body. So I'll talk, if we have time, I'll talk a little bit more about that later and how it relates to some things going on in our world right now. But when we look at hormones, women know hormones are central, right? When we feel crazy and we know we're being irrational, it's probably a hormone, right? When we know we're not eating more or we're exercising more, we're not losing weight, I think it's hormonal. We know these things. And the reason that women are so, why I love how you named it taming hormones, because women sometimes feel like my hormones are out of control. I do not know what's going on. And that's why I love to talk about hormones with women and demystify it and just talk about the simple things and then some of the more complicated things we can do to fix problems.
What would you say at the top? I know there's so many conditions, and we really can't go into all of them because the hormones, how many, and the imbalances that sometimes there's interactions between the hormones. But if you have, top 3 that you are dealing with practice, what would they be?
Definitely the top would be adrenal.
Mm-hmm.
So the adrenals are 2 little glands that sit on the renals, ad meaning on and renal meaning kidney in Latin. So they sit on the kidneys and they provide a lot of the cortisol in our body that's supposed to peak at 8 a.m. and go down through the day and be very quiescent at night so that growth hormone can do its job at night. So adrenal problems are very central to all of this because the adrenals produce our stress hormones. And if we're always under stress, guess what? Our adrenals start to fatigue, and then we're not producing one of the main building blocks for hormones, our other hormones, which is DHEA. So all the ways we live now, and this is what I teach my patients, it's like we're mammals. Mm-hmm. We drive cars and we wear earrings, right? And we have face cream and makeup. But we are mammals. And the more we get away from living with those mammalian natural rhythms and those mammalian activities that are built into our DNA, I'm really passionate about this, the more we run into problems. So the more we get back to natural rhythms, the better we do. So, the adrenals produce stress hormones. And when we're eating on the run, stressed when we're eating, under a lot of stress at work or at home. And I'm a big believer that, I talk to women all day long. It's my job. At least half of women's stress is not coming from work or kids. It's coming from relationships that are not going well, that are not healthy.
Wow. That's big.
It is. And, I've heard so many stories of women over the years where they live in an unhealthy, unsatisfying relationship, and then they get physically ill, right? Autoimmune disease. Thankfully, not cancer very often, but there are a lot of chronic problems that women will come in and they will tell me their stories, and they will tell me of, and it doesn't have to be abuse or anything super dramatic, but just enough toxicity or enough not being seen, heard, understood, to lead to enough relaxation in their human being. So because of my counseling background, I take a really holistic view of all this. And I think relationships are very important to our overall well-being. And we're not always honest with ourselves about our relationships and the role they play and how we feel about them. So that's part of what I help women with too, just as they're ready. I don't, every woman comes to her own realizations when she's ready, but it's something I don't shy away from. So, we do know that when we have a relationship that is supportive and we hold our partner's hand, what happens? Our blood pressure goes down, our cortisol goes down, right? We know this from like John Gottman's work in relationship psychology. When we have a partner we're at odds with, guess what? Our cortisol goes up. Our fight or flight goes up. In fact, I do neurofeedback with many couples who are in couples therapy because it helps them become less aggravated, less irritated, and then the therapy goes better. So, not to derail too much, but so adrenal hormones, stress in general, stress, outside stress, inside stress. One really big cause of inside stress is part of the way we live. Sleeping and eating are survival activities. If we don't do survival activities on a regular schedule, our body says, oh my God, is this lady ever going to sleep? She's still up. It's 1 a.m. I'm getting nervous about this. Wake up in the morning. Let's say a woman fasts in the morning. She typically does not eat till noon. Then her body's fine until noon. But if 1 o'clock rolls around, she is still like, oh my God, is this lady ever going to feed me? I am stressed out. So we need regularity, like I was talking with the rhythms before. And that's one of the main ways we can balance our adrenals. When our adrenals are imbalanced, the kind of things that we see are poor resistance to stress. So being easily startled, easily stressed, easily overwhelmed, fatigue, especially at the 2 or 3 p.m. mark. Have you seen those lines around Starbucks at 2 or 3 p.m.? It's like they're giving it away. They are almost giving it away in there the way the lines are. I always drive by and I say to my daughter, there's the adrenal line. And she laughs because she grew up with me. She knows I'm weird. So, and then also the other part of adrenals when they get further along is women they'll have that dip at 2 or 3 p.m. and either they'll get a little second one and then crash at 7 p.m. or they'll be awake and they have trouble going to sleep until maybe the 12 or 1. And then when they finally get to sleep, guess what? They don't get into deep sleep until 7 o'clock when their alarm goes off. So that's what I call an adrenal flip, is feeling really tired in the morning, awake at night, and then you're finally in a deep sleep when your alarm goes off. That is a typical adrenal pattern and something we do not need to live with. We should feel energy during the day until we're ready to go to bed. We should sleep well because our cortisol is actually turned off at night. And we should wake up feeling refreshed and like we're ready to greet the day. So those are just some symptoms of adrenal fatigue. But, when I'm talking about it, I guarantee that a lot of women watching this will be like, that's me. That's everyone I know. I thought that was normal.
So if that's the first condition, we'll get to the solutions. I'm hoping that, well, I've been surprised with a lot of these things that when you look holistically, the solutions tend to be similar in a lot of ways, although there are differences. So if adrenal, I can definitely relate to that when I was working full time. So I do see my a lot of that, and quite frankly, I do see it a little in my mom. I get, Mom, I think I need to talk to you about this. So if adrenal issues, and I know that adrenal issues are also very much related to diabetes as well, and that hormone spikes, that whole diabetic cycle as well. So we can't really separate those issues. But what would be the second one? Adrenal issues.
For women, I would say estrogen dominance. So when we look at imbalance in the female hormones, it's so I've been doing this a long time, and women will come there like, I think we need more to test my hormones. I'm like, well, let's talk for an hour and see what's going on. Like 90% of women, American women, have the same imbalance in their female hormones, which is too much estrogen, with the same type of constellation of symptoms, which is heavy periods, premenstrual mood changes, which can be anything from feeling more teary to being really irritated on a spectrum to PMDD, which is almost rageful or feeling suicidal and things like that. And then let's say cramps, heavy periods, irregular periods, and yeah, those are the symptoms that women will tolerate. And sometimes estrogen dominance causes things like fibroids, or like one of your followers was asking about endometriosis. That can lead into estrogen dominance, can lead in there too. But estrogen is the hormone that builds the lining of the uterus the first half of the cycle, so that if there's a fertilization, the egg has a good place to be, right? So it's a really simple concept. The estrogen makes the bed, basically, for the developing fetus. If it's not fertilized, then it will start breaking down as progesterone peaks at 21 days. If there's no implantation, it starts dropping. Progesterone is the one that keeps the blood in there. So as progesterone drops, some women will have spotting, but as it drops enough, precipitously enough, then we start our menstrual period. So when we have too much estrogen, these are the type of symptoms that we see, and it's not hard to balance it. This isn't rocket science. To standard medicine, it is kind of, because I always tell my patients, if you're in a car accident, go to the hospital. Do not call my office. I trained in minor surgery. I haven't done it for 12 years. I don't focus on it. I don't do any minor surgery in my office anymore. I don't do enough of it to stay good at it. I'm really good at helping to restore health, balancing hormones without using hormones. Hormones don't grow on trees. We should not be eating them. Why have we been eating hormones?
Because we've been feeding to the animals and we see what they do. So we figure that we can.
Right.
We want
because standard medicine, unfortunately, with the advent of with pharmaceutical medications, which are really the new kids on the block, as far as people say, why aren't you a traditional doctor? I am. One of my professors in my naturopathic medical school, her father taught at University of Chicago Medical School. He taught hydrotherapy there. Hydrotherapy is using water, different temperatures of water, to stimulate the body. So either white blood cells or circulation, or different kinds of healing. So using water and diet and herbs and botanical medicine, and in my practice, I use neurofeedback, which is using electricity in our brain to rebalance our brain waves. That's traditional, that's naturopathic. So when we started developing these medications, because we had a lot of extra oil to be used, we started developing these pharmaceutical medications, and so women started taking hormones when we realized there were hormone imbalances, and standard medicine didn't have a way to treat bad menstrual cramps, fibroids, really heavy menstrual bleeding, even mood changes with menstrual periods. So the hormones were given as a Band-Aid to help the symptoms. Of the problem is when you give a hormone, an endogenous, meaning outside the body hormone, you're not solving the problem underneath here. And the problem just brews along. It just keeps going. And then the woman goes off birth control to try to get pregnant. we don't know what's going to happen. Is she going to have problems with her fertility? Are her periods going to be difficult? Is she going to get pregnant right away? And then after the baby's born, I always say pregnancy is like throwing up your hormonal deck of cards. And we're going to see where they land. And often where they land is based on how balanced your hormones were before pregnancy. The same thing is true in menopause. If you give me a woman who's going through menopause, who's about to go through it, I won't be able to tell you how easy or hard it's going to be for her based on her hormonal history. Wow. So these things are not, and also hormones based on early childhood experiences. Was there abuse? Was there trauma? Was there stress as a young child? Does the woman have other health problems now? If a woman has a lot of health problems, I guarantee her hormones are going to be imbalanced. There's no other way it can be. And that includes sleep problems. So yeah, I know I'm talking a lot. Go ahead.
No, you've just given me so many gems. My mind is buzzing on the whole estrogen equation and how we've just put a Band-Aid on top. I mean, I took the pill for a while, and I love the way you described it, because that's how I felt. I actually felt like my body was hijacked by aliens. That's the best way I describe it. I could feel what the pill was doing, and it was dominant, but somewhere under that, I could still kind of feel some of my normal rhythms. And it was like, I know that there's reasons for taking them, times to take them. But one more thing on the estrogen, which I only found out a bit recently, is because it builds up. High estrogen, and correct me if I'm wrong, is also associated with a lot of cancer.
Yes, a lot of cancer, especially breast, uterine, those type of cancers are associated with estrogen. They're what we call estrogen sensitive. Some are also progesterone sensitive. And we know that breastfeeding is protective against breast cancer. Early childbearing before age 30 is protective of breast cancer. Interestingly enough, and you brought up diabetes earlier, breastfeeding is also associated with a decrease in diabetes for the child. And I don't know about for the mother. I'd have to look that up again. But there are so many over here, and I can't stress enough that we do so much research. I'll explain this to you. When I got out of medical school, there was this big book. It was like this big on dietary therapies. And I thought, I really want that book. That looks really interesting. I spent $100 on this book. This is like 12 years ago. The book is not helpful. But it's not helpful. Basically, the idea is eat a lot of colors of the rainbow, eat a lot of plant foods, chew your food well. Don't be stressed when you eat. Your hormones should be in balance. I mean, none of this is super complicated. And I always tell my patients, if we all lived in tents and had less stress and ate a whole foods diet, I would not have a job. Right? I love my job. I would be sad if I didn't have my job, but I would go be a horse trainer or something. If everyone was healthy, I would go find something else to do.
Okay. I wait for the solution over here. You got to tell me, why are so many women having too much estrogen? What's going on?
Well, that's a really good question. So number one reason, big reason, the birth control pill. Not just the pill, the patch, the injections, all the ways that we monkey with our hormones. Then we have our food. So we're looking at meat sources.
Wow.
Please, yeah. And plastics.
Okay, I heard about
that. Plastics, food, especially meat. So, we have to be a little bit more aware. The government is not always the best protector of our health. We have to be a little bit more aware of what we're doing. And whenever you're eating meat, you're eating whatever that animal ate, right? So if it's corn, if it's other animals, right?
Whatever
And so
concentrated now.
yeah, and phthalates and different things in our personal care products, phthalates, parabens.
What are those?
Parabens are a compound in a lot of personal care products. They have been associated with cancer. Synthetic fragrances. Oh, I was telling my daughter's so sweet. She's about to turn 18. I was telling her I was going to be speaking with you, and she said, "Mom, don't forget to talk about synthetic fragrances and how they're hormone disruptors."
Wow, I didn't know that.
I'm always talking with her about that. Yeah. A lot of them are hormone disruptors, which is why we can become intolerant to them over time. If you ever noticed, a lot of women, if they wore them when they were younger, when they get older, often they're just, it's like it gives them a headache or they sneeze. Things we tolerate here, as far as, I'm a horsewoman, and my horse, where he lives, where I keep him, they funnel fly spray in to the stall. They just spray it everywhere. And so that means we're all breathing it, including the horses, but everyone thinks it's great. They're like, what a nice barn. It's so nice here and I'm like, I'm trying to get away from the fly spray. Like, no, we shouldn't be breathing fly spray. We shouldn't be having, a lot of the things that are allowed in our personal care products here are not allowed in Europe. I hate to keep going back to them, but they are way ahead of us as far as health goes.
Wow, I think do share. I know maybe you might not have the time, but I would be really grateful for some of those lists, because I mean, parabens is a category, but there's a number of chemicals underneath that category. So you may look on the label, you're not going to see parabens, but you're going to see the active ingredients that fall under the category. It would be good to know.
I think for parabens, I think most of them have to have paraben in the name. You might see like methyl paraben and things like that. And one group I really love is the Environmental Working Group. They are a really amazing website where you can look up all this information. Okay. And it's constantly updated. So the Environmental Working Group,
right.
Yeah, they have all kinds of things about toxicity and food sources and personal care products, and it's lovely.
Environment. I'm going to ask for that. I'm not very good at multitasking.
Okay, I can send it to you after.
All right. So we've got number one is the adrenals, stress, eating right, and then number two, our estrogen levels are all over the place, and that cancers and heavy periods. And number three.
Number three is thyroid, but not in the way people think. Not in the it's absolutely going to come up positive my blood work way, although sometimes it does. Now, everyone's heard about thyroid, right? I have to explain adrenal to people, but thyroid, we've all heard about it. It's this gland right here. And our brain stimulates our thyroid to work when we don't have enough thyroid hormone that's active in our tissues. So I like to test thyroid like about 4 different ways for women. I don't just test the TSH. I test TSH, free T3, free T4, often reverse T3, and sometimes some others. But the reference ranges that are commonly used for TSH, which is the one from the brain that stimulates the thyroid. So if it's higher, it means your brain's working harder to stimulate. So if it goes up, that means your thyroid might be struggling and not functioning as well. That's something a lot of women ask about. Why is this bad if this is up? Because it's your brain working on your thyroid. So a lot of the reference ranges don't capture a lot of the kind of subclinical, I call it, thyroid problems women have. One thing I like to do is take women's temperatures. So we're supposed to be 98.6, right? I
Okay.
guarantee if you take 100 women's temperatures, 85 of them are going to be below that. Most of them will be below 98 or maybe around 98, 98.1. All our enzyme systems, isn't that interesting? All our enzyme systems are designed to function at 98.6. So guess what? If you're consistently low, your body is not, in fact, it was funny this summer, I went to my gynecologist, for my annual, and she came out and she took my temperature, on the street, her assistant did. And I've been kind of running around that day and taking my kayaks on and off my car. And she said, "Oh my gosh, your temperature is elevated." And I said, "Oh, I've been running around." So we waited a minute or two. And then she took it again. She said, "Oh," she said, "it's 98.6 now." She says, "I never get people at 98.6. She said, "Everyone's like always below 98. And I said, "Yeah, I know. It's because of our general poor vitality." So you want your resting temperature to be 98.6. I don't mean the basal one when you first wake up in the morning and, the fertility, that. I mean, when you're walking around during the day and you've kind of been up and at 'em, you take your temperature, it should be 98.6.
And that's with the in the mouth,
Or I use a temporal one. Anything that's accurate is fine. So if a woman, so many women have low resting temperatures, and part of what I do in treatment with a lot of women, especially women that have some of these other problems, right? Female hormones and adrenal, which is so common. It's like, almost what woman doesn't have a lot of these? She usually doesn't show up in my office. She's out being super healthy, active, not even thinking about her health because she feels so good. But a lot of women come in presenting with more of these type of overt symptoms, but I always, as part of treatment, treat thyroid. And the way I treat it, I don't need to give a thyroid hormone. I don't give hormones. Hormones don't grow on trees. I use different botanical medicines that balance the thyroid, and they are manufactured and developed in Europe because, again, they're far ahead of us. And they are, in fact, I always say I never met a thyroid I can't get along with. If you have a thyroid gland, I can get it to work, even if you have like overt thyroid disease. So I've helped some people actually get off of thyroid hormone, but a lot of women just avoid being prescribed it. And and I'll share an interesting thing about the thyroid. The thyroid also has to do with our voice and being confident and kind of speaking up and using our voice. So sometimes with women, I treat that aspect of it too.
The throat chakra, yeah, definitely. From that. Now, what would some of the symptoms be on the thyroid? I mean, we spoke about the body temperature being a little bit low, so maybe you feel cold very easily, I would imagine. What are the symptoms?
Well, the overt ones are, if you're low thyroid, feeling cold, which can be a lot of different things. That's, again, where the tongue diagnosis comes in, and I can tell the difference between some of these things. Feeling sluggish, being constipated. So ideally, we have a bowel movement after every major meal. For a lot of women, that means twice a day. So, if a woman's telling me like less than once a day, it's like, what's going on there? So sluggish digestion, depression, or again, so many people have low moods. It's a combination of a lot of things. And people say, "What do you do to treat depression?" I'll say, "What woman? I need to sit down with her for an hour. Then I'll tell you." Or they'll say, "Is coffee good for you?" I'm like, "Let me talk to you for an hour and I'll tell you." So it's all individual. But So thyroid, those are some of the things. What I do sometimes with women in office, or if I'm treating them, is I'll give them a little thyroid homeopathic at a low dose. And if they feel a certain way after I give it to them, that is one way too. But again, I don't have to do too much extra work because I can always give some gentle support to the thyroid, and there's no downsides to it. There's no side effects. There's only upsides. So.
Great. Now, yeah, thyroids are very complicated because I think a lot of the symptoms that you have described are more of hypothyroidism, where the sluggish, and I guess that is the more common thyroid that you are presented with, as opposed to the opposite end of the spectrum, which is where it's overactive, hyper.
Yes, and that happens too sometimes as a precursor. You know, hyperthyroidism will often happen before low thyroid because it burns the thyroid out and goes low. So usually that phase is pretty self-limited. And often those symptoms are really more severe and people will end up in an endocrinologist's office. So, but more what happens, and I'm glad you brought this up because this brings in autoimmunity. The other test that I do a lot for thyroid is the anti-thyroid globulins, I'm saying it wrong. There are two different thyroid antibody tests that I'll do. And we want to find out when people come in and they are low thyroid and they've been taking thyroid medication for years, I always ask them, is yours Hashimoto's? Is your autoimmune? And usually they'll say, I don't know. So then I want to test the antibodies because we know for sure then if it's autoimmune in nature, I treat the immune system. We don't just treat the thyroid itself. We say, where did this come from? Because guess what? If they have an autoimmune problem with their thyroid, and women have the majority of autoimmune problems. Isn't that interesting?
Heart chakra.
And guess what? Right. Guess what immune system does, right? Autoimmunity basically means we're attacking ourselves. So like, it's no mystery to me why women, I'm not saying we're attacking ourselves, but the immune system is about knowing yourself versus your not self, being able to filter, right? And as women, we're not always taught so well how to filter. We're taught how to take care of other people.
That is really, really interesting. I mean, you know, I irritate people. I think this is why I enjoyed the interviews. I actually, I'm supposed to ask questions because I'm like that person in the conversation. Is why? What?
Yeah. Why? Yeah.
Why are we having so many thyroid problems? What's going on? It's not normal.
It's not normal.
It's common, and you think just because it's common that common means it's normal, but it's not the way we are.
It's not, but remember this triangle.
Okay,
so we have stress, and then we have hormone problems, which are sometimes due to outside factors and sometimes due to inside factors. Then, and all the things that affect these, stress and toxicity, also affect the thyroid. So it's like, how can we not? So this is what's so neat about talking about hormones. When we become out of balance, we're out of balance. Everything's out of balance usually. It's not pieces. We're not machines. The same thing with the brain. When I work with people on their brain health, I say to them, when you start feeling a difference, I can't predict what that's going to look like. For some people, they say their brain fog starts to go away. Other people say, my mood, I'm not getting depressed anymore. I look at something and think that should depress me, and it's not. Other people, their sleep gets much better. But it doesn't matter because as a whole, it's all going to happen. I know it's all going to happen. I don't have any doubt or any need to micromanage. I just do what I do. I do what I know works. I pay attention to the individual person. and their temperament, their constitution, all those things that make them a unique person in their healing journey, and work at that level, is the same thing with the rest of the body. There's no way, like I said before, there's no way a woman sitting across from me who has multiple different health problems and told me she has a stressful childhood, is when I ask, how's your menstrual cycle? There's no way she's going to tell me it was normal or menopause was easy for her.
Yeah. Yeah.
It goes against the natural law.
That's true. So it's everything is linked together.
Yeah.
So the other two causes that you spoke about will affect the thyroid. I mean, the thing that has blown my mind as I've been researching, and I'm totally intrigued by hormones, is how much stress is part of this equation. And the thing, and I kind of wondered about this for a very, long time. Why is stress? Why is high cortisol such a big issue? And the thing that, and I'd like to know what you think about this. The thing that made sense for me is the raw ingredients for the hormones are, they're using the same, the way I understood it is they're using the same raw ingredients. So they're starting off with cholesterol. And if we have this amount of cholesterol, and this cholesterol, a lot of it gets shunted up in the adrenals to make cortisol. Then we're probably not going to be having enough for some of our other hormones, maybe progesterone, maybe the thyroid and the others. So we have more of the stress hormone causing they're there to protect us for a limited amount of time. We're not supposed to stay there. And then we have a deficiency on the side. So it seems like stress management, as you pointed about in the adrenals, is maybe the kingpin. I kind of see it as the kingpin into this, but I want to know what your take is on this.
I totally agree with you. I don't think all stress is bad, by the way.
Yeah.
So just like there's this term called hormesis, and it means that a stress of the right type, of the right amount, and the right timing can actually make an organism stronger. It's a really interesting idea. And so stress in and of itself isn't bad. The problem is the doses, the kinds, and the duration of stress that we have, that we've gradually started to tolerate and think is normal. When you run into someone, how are you busy? It's like, oh, I'm busy too. Oh, and if you're not busy, something's wrong. Is it something wrong with your business? Or, well, if you're not busy, it's like, yeah, why do we have to be busy? And why is being a badass so great? And it's like, what about rest? What about like balance and taking care of yourself and just kind of living a normal life? So, we tend to be so hard driving. And I have this, I'm going to grab this because I really love this. Hold this up. It's basically sunset. It's the Dalai Lama. Man sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then, I'm reading backward. And then he is so anxious about the future that he does not enjoy the present. The result is that he is not in the present, or that he does not live in the present or the future. He lives as if he's never going to die, and then he dies never really having lived.
Yeah.
I mean,
we're not here.
Right? It sums it up. Like, what are we doing?
Yeah. No, I think what I love about yoga in terms of bringing us into the moment, and when we are in the moment, I mean, a lot of what we're stressing about is something that is past. I should have, or something in the future. What if this happens? I need to do. But if we take a moment and we breathe and we're with our body, we can actually let go. Now, this is an incredibly interesting topic, and I'm kind of like guarding the time over here. So, and I want us to reserve just like, 5-10 minutes for questions. So we've spoken about the three main issues. We've spoken about some of the causes. Let's talk about some of the solutions now. I know you can't do all of them, at least, the ones that are within people's control. I mean, if they do these basic ones, I mean, everyone knows that, there's home care medicine that we've grown up with. And when we do that and we try that and that doesn't work, then we go see the doctor.
Yes. Yes. Well, the first thing I'm going to talk about, so there are things that you can do, which are lifestyle practices. There are things that you can take. And what I notice is everyone wants to think food can solve all their problems. So either food's causing all their problems, or if they change their diet, it's going to solve all their problems. Food is important, and we really relate to it because we eat it 3 times a day or 2 times a day at least. Mm-hmm. But by the time you have some kind of long-standing entrenched health issues, just changing your diet is not going to change everything, unless you have celiac disease and all your symptoms are because of that. That might change your life, sure. But food is a part of it, and food can cause the wrong type of foods for our body. Can cause a lot of stress on our body, but and partly probably because I live in Portland and we're totally obsessed with food here. Totally obsessed. Like, we have the best restaurants here. And we think that if we change our diet, it's gonna just solve everything. But that's not always the case. Food's part of it. But I'll tell you my number one thing I work with people on. And if patients come to me with this being their main complaint, I tell them, you're so forward-thinking, you're so far ahead. It's sleep. In the 15 years I've been in this profession, I've only had 3 people come to me and I say, oh, can you just in your own words, I've read your paperwork, can you in your words, kind of start talking about why you're here. Only 3 people have said, my sleep is not very good. Do you think that means the other people's sleep is good? No, it just means they already had a lot of other problems that were partly linked to poor sleep. So we need to consider sleep problems a health problem. We also need to consider sleep more of a foundational solution. Sleep is not a good thing to give up to work, to work out. Sleep should not be negotiable. Most women, a lot of women are what I call 9-hour sleepers. We feel best on 9 hours. So that whole 6 to 8 thing you hear, not for most women, especially in the winter. Women tend to need a little more sleep than men. We tend to need a little bit more in the winter than the summer, especially if we have a big change in our day length. So where I practice, that's the case. But in general, we need more sleep, and a lot of us are 9-hour sleepers. And not only is the amount of sleep really important, the timing is very important. So for every hour you get before midnight, it is worth double for regenerating your adrenals as the hours after midnight. That's why if you sleep from 10 to 6, you will feel better than if you slept from 12 to 8. In general, most people will notice that.
And this is, I don't know, you probably deal with Ayurveda, but that is exactly what Ayurveda says, the system of yoga. They say you wanna sleep in that kapha window, which is between 6 and 10 p.m. And then if you don't, then you're in I think it's in the pitta, another window.
Yes. Yes. Oh, I love that. And someday I'll study more Ayurveda because I find it really fascinating. I just know a teeny tiny bit about it. But so what happens for people is, you'll be tired in the evening. And then if you stay awake, you'll be awake. Expression. Your adrenals turn back on. They're like, oh my gosh, this lady needs to be awake. I'm going to pump some more cortisol out there. and then you can't go to sleep until 1 or 2 in the morning. So yeah, we need to sleep in those natural windows. And that's part of what I teach people about. Also, our children need to sleep better. So when children go to sleep later, we've done research about, like, we need research. When children go to sleep later and don't sleep well, guess what? Parents go to sleep later and don't sleep well. So I just had 2 women in here this week, and they're going to be bringing their kids in because we need kids to sleep for parents to sleep well. Also, not just the sleep windows, but the sleep quality. So are you easily awoken by your animal or your spouse or the noises outside? Are you sleeping deep? Maybe you'll wake up to urinate. Most people over 40 wake up to urinate once at night. We hope it's not more than once until we get into our 60s maybe, and even that we can work with that. We can change that a little often. But it should be a good deep sleep where you're getting through all your sleep cycles. And a lot of people, they're having these adrenal problems. Guess when their adrenals are turned on when they're not supposed to be?
At night.
At night. And when I said to people, how do you feel in the morning? Oh, I jumped right up out of bed. I'm like, yeah, you weren't even really asleep. Your adrenals were turned on halfway, probably all night. And so, and I will, they'll also tell me their energy is pretty low all day unless they drink coffee. So,
hence the coffee addiction.
Hence the coffee addiction, right? So the so growth hormone is antagonized by cortisol. So if your cortisol is high at night, growth hormone can't do its job. Cortisol is like a bully. It's like, no, growth hormone, no. Growth hormone is, and we've heard it because it's bandied around with a lot of the anti-aging ideas. But growth hormone repairs our cells and gives us that really deep, good sleep.
Beauty
so
sleep. Something.
Beauty sleep. Yes. And we talk about that because we're obsessed with aging in our culture, right? We're obsessed with it. I hope I'm not losing my battery here. We're kind of obsessed with aging or not aging, but we want to get that deep restorative sleep that growth hormone can give us. And that means that we need to get our cortisol down at night. And if it's not going down on its own, I do things with women, use different herbal treatments to help get it down. And sometimes I do neurofeedback too. But we need more than just trying to go to bed at a different time. If we've been through years of adrenal, inadequate sleep, stress, those type of things.
Great. So it's the eating, it's the sleeping, and is there anything else you'd add? And then I want to squeeze in some questions over here.
Yeah, I think, when people start getting enough energy, exercise is really important because that's going to help with good sleep too. Mm-hmm. So, not for the typical reasons of, exercise does so many things for us more than just maintaining our weight or building muscle and things like that. It's pretty underappreciated for all the other things it does for us.
Mm-hmm. 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 Great. All right. I'm glad we've answered the endometriosis question, and that is linked to could be linked to high estrogen. We've got one question here from Judith Buku Katambo, who is asking about a condition called gynecomastia. And
yes,
how I think you saw that one. How would we treat that one? So if we can spend a few minutes on that, then.
Yeah. Gynecomastia is basically when men start developing some fatty breast tissue, and it happens, it's pretty common, maybe like 25% of men, I think, will develop something like that in their lifetime. It's different than male breast cancer, which can also happen in that tissue, but that's much more uncommon. So men have also lifestyle, stress related hormone problems, and you heard about testosterone problems for men. There's a lot of advertising. Men spend a lot of money on this. My joke about the 2 reasons men typically go to the doctor. You want to hear it? 1,
erectile dysfunction.
One is they're about to die. 2 is something's wrong with their penis.
Yeah.
And so testosterone goes into this category. But when a man has less testosterone, often it's getting converted into estrogen. And the estrogen is what creates that low testosterone, higher estrogen is what creates some of that fatty tissue, which makes sense, right? We have more fatty tissue. We hold hormones in our fatty tissue, which we could talk for days about this subject. But so that's part of what's happening for men there. And they need to balance their hormones just like we do. And a lot of it's the same type of thing: stress, sleep, eat clean foods, and there's botanical treatments we can do and things we can do to get their testosterone going on the right pathway without giving them testosterone. Beer, men and beer. Beer is a big aromatase potentiator, meaning it aromatizes the estradiol, so it will turn male hormones into estrogen more often. So when I test a man's testosterone, I always test the total and the free. The free is the hormonal, the active one. And then I also test for estrogen, because I want to see if it's getting shunted over there. So men get older, and you see the bellies, right? And our culture is very much tolerant of bellies in men, but not women.
That's right.
Right? They can drink the beer and do all this stuff, and we're supposed to be gorgeous. So they they'll get the bellies, lower muscle mass. You'll start to talk to them. They're feeling a little tired. Libido, I love to talk about libido. We can talk about libido another time. So in a nutshell, that's part of what's going on there.
That's a great answer. And I think that tags on very nicely to what we discussed last week with Dr. Towani, who's a urologist in Zambia. Now, one more question I have here from Sarah Ash, and she says she has questions about melatonin, and she heard that taking a supplement to help sleep, because I know melatonin is connected to sleep. If you can elaborate more about that, what exactly melatonin does. So she says she's heard that taking a supplement is counterproductive. So she wanted to know, she's struggling to sleep. What could she do apart from, lithium?
I love that question. I was going to mention melatonin earlier. It's a hormone, and people are even giving it to their kids now to sleep, which is a little horrifying to me. Melatonin can be helpful for some people. It can be really helpful, actually, when I work with people with cancer. It's a really good antioxidant in high amounts. But for sleep, so many other tools. And again, I don't think we should be eating hormones. And so melatonin helps, it responds to the light dark cycle. So it kind of like tricks your body into thinking it's time to go to sleep when your body isn't, when your adrenals really aren't with the program like we've been talking about. The problem is that it's a hormone. So it's pretty strong and it can affect your other hormones. B, a lot of people don't realize this, but melatonin can cause night waking. So you might go to sleep, but your sleep cycles are affected and you might be awake later in the night. I've had so many patients over the years come and they're telling me I take 5 or 10 milligrams of melatonin at night and it helps me go to sleep. And then I say, and do you stay asleep? And they say no. And I'm like, oh, let me tell you maybe why. And they had no idea that the melatonin might be part of that. But melatonin is one of those things that has gotten in popular usage and it's just like become a fad and it's everywhere. And if 3 milligrams doesn't work, I'm taking 5 now, I'm taking 8 or 10. So many other ways to actually heal. So the melatonin, again, is kind of like we were talking about with the other hormones. The problems are still going on. We didn't solve the problem. We just tricked the body into going to sleep.
Mhm, mhm, mhm.
So we need to work on what's really going on. And it depends. I mean, like I said, so when we're talking about sleep problems, either going to sleep or waking up, typically there's some different systems involved. One might be the nervous system. One might be the adrenals. We also see blood sugar. I also see sometimes the kidneys involved. So I love that lithium thing. The kidneys, if your person's waking up usually between 3 and 5 a.m., that's in Chinese medicine, there are organs associated with the times of day. So when we're sleeping, kidney time 3 to 5 is really popular when people wake up. And actually, I give really small physiologic doses of lithium. Lithium's in lentils, actually. So you can give really small amounts to ground the kidneys. And often people that wake between 3 and 5 also have a little anxiety. So it depends. When you wake up, are you anxious? When you wake up, is your brain going? When you wake up, are you hungry? Like, what's going on? It's not the same for all people.
Mhm.
So that's where I'm really a detective. Like, I ask questions and figure and solve problems. Like, that's what I do. If someone came to me and said, I'm a detective, I say, we have the same job. Like, really?
You're forensic. You're doing
Yeah.
forensic on living bodies.
Right. And I have a new friend. He's like, you ask so many questions. I'm like, I do it for a living. I'm so curious. I love asking questions.
Oh, get someone else like me, because some people, I can see people's faces like, oh God, she's asking me another question.
Oh no, it's great. It's great.
All right, I know we're short of time, so the last question that we had was, can lower back pain be associated with hormonal imbalance?
Oh,
What is the symptom
yeah.
and long term?
Well, so lower back pain is the most common type of back pain. And lower back, I'm just going to give a little over. Lower back pain is usually caused by tight hamstrings. So I always tell people, if you have lower back pain, check your hamstrings. Can you, with your knees locked, go down and touch, like with your palms, the floor?
Palms, not fingers.
Palms. Try the palms. Like, most of us should be able to do that. I mean, depending on your anatomy, right? I mean, if you have super long legs, and we'll make allowances for you. But some people can't even get to their knees, because you teach yoga. So that's one thing. Lower back pain. Well, if it's during the menstrual cycle, yes, a lot of people have back pain as instead of like front, like uterine pain, it'll come into the back. Sometimes women with endometriosis will have back pain even when they're ovulating. Every problem in the body could be related to hormones, right? That's what we've been talking about. Mm-hmm. But some types of back pain are really just certain muscles. Is the whole body's health going to be improved by treating our hormones? Absolutely. But yeah, I mean, you'd need someone to check that out who's good at body work and can do some tests and figure some things out for you. Because sometimes it's structural. Sometimes people have an extra vertebrae. I mean, it's just a multitude of issues that could be.
And sometimes we're looking for problems on a physical plane, and it's actually in the mind as well. It's on the energy. I mean, it's worry, concern. I definitely experienced that with, I think, once or twice with myself, and definitely when I ask clients questions, what's going on right now? There's a lot of fear, especially around finances and financial stability around it can also lead to it. So sometimes the answer is not necessarily I've seen in the physical plane. Well, you know that because you're a psychotherapist. You know that how what manifests in the body is a lot in the mind. I loved what you said in the beginning about 50% from your experience, 50% of the stress that women that you are dealing with is coming from their relationships. Wow, that also tells you that it is starting not on a physical plane, but it is relating into a physical plane. I could talk to you for another hour. I kind of feel like I've just scratched on the surface, but I am mindful of the time, and you might have someone in your waiting room. So I'm going to let you go and just say thank you so much for sharing your time and allowing this total stranger, I thank very much, Sarah, as your cousin for introducing us. I like stand my tentacles out and like, who do I know in this that might know a doctor? So people are getting all these random messages from me. I'm like, it's really been such a pleasure to meet you. Thank you for indulging me and the whole of the Kuthuta Yoga Society. Please join us, be part of this community, and I really hope to see you and hear from you and interact with you again and again. You have so much to offer, and I have, from what I've read, I have got some real gems from you that I haven't heard anywhere else.
Thank you, Towani. It's been a pleasure.